Welcome, future nurses. In this explainer, we're going to master a skill you will use all the time, applying anti-embolism stockings. Now, I know it seems pretty simple, but believe me, getting it right is absolutely crucial for patient safety. So let's break it down.
So here's our game plan for today. We're going to follow the nursing process right from the beginning to the end. We'll start with the why and the prep, move through the actual application, and then wrap up with evaluation and documentation. This structure is going to give you a really clear path to mastering this skill with total confidence. Okay, first up, let's get really solid on the why. Before we even think about touching a stocking, we've got to understand its purpose. This isn't just about mindlessly following steps. It's about knowing why every single step matters for safe and effective care. So these aren't just any old tight socks. They're actually prescribed medical devices. Their main job is to apply what's called graduated pressure to the legs. This pressure helps push blood back up towards the heart, which prevents it from just sitting there and forming dangerous clots, a condition you know is deep vein thrombosis, or DVT. All right, let's talk about preparation. What you do before you even enter the patient's room is just as critical as the application itself. Getting this part right really sets you up for a safe and successful outcome. Your first couple of moves are basically pure detective work. You're going to dive into the patient's chart, look for any contraindications, and then gather all your equipment. This prep work shows you're a pro, and it's the key to making the whole procedure go smoothly. And before any patient contact, we always, and I mean always, pause for these non-negotiable safety checks. Think of this as your safety net. Think of these 4 steps as your universal shield. You're confirming you have the right patient. You're checking for allergies like latex. You're practicing good hand hygiene, and you're making sure you know your facility's specific rules. This process is what prevents errors and protects both you and your patient. All right, now for the main event, the hands-on application. We're going to walk through this nice and slow, step by step, so you can perform it with confidence when you're out in your clinicals. We always begin with the fundamentals of compassionate care. So provide that privacy, introduce yourself, wash your hands, and explain what you're about to do. And remember, this is not just a checklist. This is how you build trust and help reduce your patient's anxiety. Now we switch into assessment mode. You're going to check the patient's skin and circulation, then get them positioned, ideally lying on their back with their knees slightly bent. And this brings us to a really critical step, measuring for the correct size. Using the wrong size can be dangerous. It can actually create a tourniquet effect and increase the DVT risk. So you have to get this right. This little technique makes the whole process so much easier. By rolling the stocking down, you can guide the foot in nice and smoothly. Pausing at the heel is a bit of a pro tip. It lets you check your placement and make sure the toes aren't all cramped up before you pull the stocking the rest of the way. You've probably seen this done pretty quickly, and you might be wondering, is getting every single little wrinkle out really that big of a deal? And the answer is yes, it absolutely matters. Every single wrinkle acts like a tiny tourniquet. It creates a point of excess pressure that can mess with circulation and even lead to skin breakdown. Getting it smooth isn't just about making it look nice, it's a huge part of patient safety. So to finish the application, you'll unroll the stocking up the leg, and your other hand should follow right behind it, smoothing out any wrinkles as you go. Just remember, a smooth stocking is an effective and safe stocking. Great, the stocking is on. But guess what? Our job isn't done yet. The evaluation phase is where we confirm that what we've just done is both safe and effective for our patient. Placement has to be precise. For knee highs, you want the top band about 2 finger widths below the crease behind the knee. For thigh highs, it's 2 finger widths below the gluteal fold. You know, that crease where the buttocks meet the thigh. This exact positioning is so key to prevent the stocking from rolling down and cutting off circulation. Okay, this next part is a critical safety check that is so often missed. The 30-minute follow-up. After you apply the stocking, you have to come back within half an hour to reassess. You're checking circulation, skin integrity, and their comfort level. This follow-up is totally non-negotiable. And before you walk out that door, every single time, you do a final safety scan of the room. Is the call light in reach? Is the bed in the lowest position? Are there personal items close by? This is how we prevent falls and make sure our patient is safe after we leave. Finally, let's talk about what to do when things don't go exactly as planned and the vital importance of documentation. This is where your critical thinking and your professional accountability really shine. If you find an issue, like some skin irritation during your assessment, you do two things. First, investigate. Double-check the fit in your application. Second, you escalate. Report what you found immediately to the primary provider. You've got to remember, you are the patient's first line of defense. You've heard it a million times, and it's because it's true. If it wasn't charted, it wasn't done. Your documentation has to be precise. You need to include the date, the time, the type and size of the stocking, your key assessment findings, and anything you did about it. This creates a clear legal and medical record. This quote really just drives the whole point home. Your notes are a vital communication tool. They're not just for you. They allow the entire healthcare team to provide that seamless, quality care for your patient. So as you head to your next clinical, I want you to really think about this. Applying these stockings isn't just some task you check off a list. It is a powerful intervention. By mastering this one skill, you are directly preventing a whole cascade of complications, from DVTs all the way to life-threatening pulmonary emboli. Never forget, what you do really, really matters. Hey, if this explainer helped you out, do me a favor and give it a like and a subscribe for more nursing school breakdowns. And if you're prepping for the NCLEX or any other exams, definitely check out the links in the description for our revision books to help you succeed. Thanks for watching, and we'll see you in the next one.